Hi, I am Dr. Selvaraj, your surgical educator from Malaysia. Welcome back to my series of surgical teaching video casts. These are meant mainly for undergraduate medical students doing their surgical clerkship rotation and the surgical trainees. I promise you will become competent in clinical problem solving and surgical decision making if you are going to watch these videos over and over again. In this episode today, I am going to talk about mind maps in surgery. You know, in all my didactic videos, I used to include the mind map. This is a diagrammatic representation of all the information discussed in a single page. That is what is called mind map, and this episode is only an introduction to the mind maps. So you can see three unique features in all my videos in the channel. Those are mind maps, diagnostic algorithm, and treatment algorithm. See, the teacher's job is not to just bombard the students with enormous facts and information, but they should also help the student to retain what has been taught to them. So keeping this in mind only, I have included powerful teaching tools. These three things are very powerful teaching tools, namely the mind maps, diagnostic algorithm, and treatment algorithm. And you can see in all my didactic lectures or the didactic videos, I have included all these three things in each one of these videos. In this episode, I am going to talk about the mind maps, and I am going to produce a series of videos concentrating on the mind maps. The individual diseases, only the mind map. So these videos will be only a shorter version of the main videos. Usually all my videos are between 30 to 45 minutes, but these videos, no, the mind map videos will be less than 10 to 15 minutes. So what is mind map? This is a learning, mainly mind map is a learning strategy underutilized in medical education. Mind maps are multi-sensory tools that may help medical students to organize, integrate, and to retain information. It is a diagram that is used to visually outline all the information. Mind map is a large brainstorming web where a central word or idea branches out into related subjects. Firstly, the main study topic is drawn at the center, the topic of the study, which allows the students 360 degrees of freedom to develop their mind map with keywords, pictures, branching at a divergent pattern. So from these main branches, sub-branches are created, giving further details regarding the topic under study. Tony Buzan is the one who invented the mind mapping in 1974. With three mind maps, now I am going to talk about how we are gaining knowledge from reading textbooks, seeing a patient, or reading an atlas for surgery, how to do a surgery or the operation. So the three mind maps I am going to discuss. So this learning surgery or gaining knowledge about surgery from textbook is mainly, it is system based and disease oriented, because all these textbooks, majority of them are system based. Like, see, they will discuss about the abdomen, discuss about the head and neck, and discuss about the genitourinary system, and you know the diagnosis, so the surgery topic will be there, and then you will be gaining the knowledge by reading the textbook. This is one way of gaining knowledge. Let us see this first. So if it is a surgery topic, for example, if it is acute appendicitis, then you have to think of what is the epidemiology of this disease. So in epidemiology, you have to think of what is the incidence of this disease. Is it common in male or female gender? Which age group it usually affects? And it is common in which geographical area? So all these things you have to consider in epidemiology. And the second thing you have to think is about the etiology, or what is the real cause for this disease. So it could be congenital, or it could be some infective pathology with inflammation, or this could be an autoimmune disease or a neoplasm. Neoplasm could be either a benign swelling or a neoplasm or tumor, or this could be a malignant tumor. See, this is the main topic. These are subheadings, and then these are subtopics, and these are the particulars. Even the particulars also, okay, now I am giving whether the neoplasm is benign or malignant. You can keep on branching out like this. Information you can add. That is the beauty of mind map. You can see the relationship between the different things also. So visually it is very, very impactful. So it is having a powerful teaching tool, this mind map. So the next thing is you have to ask about the pathology of this disease process. So in the pathology, you have to consider what are the structural and functional changes, or the anatomical and physiological changes occurred in this particular disease. That you have to think of. Then what are the various types of biopsies you can do to prove the diagnosis of this particular disease, and how this disease, if it is a tumor, how it spreads to other areas. That also you should know. This comes under pathology. Coming to the clinical features, this is nothing but the symptoms and signs, or the history and physicals. So this is what we are teaching the clinical students. To begin with, the junior most students in surgery, we concentrate on how to take a thorough history and how to examine the patient thoroughly. This is what we are teaching to begin with. Clinical feature, and after doing these two things, you have to arrive at a provisional diagnosis. That is what is called problem solving. And after after arriving at a provisional diagnosis, we have to do investigations. So investigations come under two broad categories. It could be a laboratory investigations, or it could be imaging investigations. So we are doing investigations mainly to confirm your diagnosis, whatever you are suspecting. The working diagnosis or provisional diagnosis, you have to confirm by doing the investigation, or you have to rule out the other possibilities or the differential diagnosis. Yeah, this is what you have to do by doing investigation. And then coming to the treatment, it could be either conservative treatment, where the patients they do not need any surgical intervention, and those patients, majority of our surgical cases, they need some sort of surgical intervention, and you should know what surgery should be done, and you should know how to do it if you are going to become surgeons. But for undergraduate students, you need not know the various steps of the surgery, but you must know what is the name of the surgery. At least you must know, because you are not going to do the surgery. So you have to know only the name of the surgery. So after that, majority or some of your surgical patients, definitely they will undergo some complication, post-op complication. And this is also divided broadly into early complication that occurs immediately after surgery or late complication. As a surgeon, you should know how to recognize these post-op complications and how to manage them. That is part and parcel of the surgical treatment. Even after managing the patient's post-op complication, post-operative period and discharging the patient, you should do proper follow-up. For benign cases, it's not a problem. The patient should come and meet you only on few occasions. But if it is a malignant tumor, then they have to come and meet you quite often. And how often they have to come, you have to tell while you are going to discharge the patient. And then what investigations you have to do while they are going to come to you for a follow-up, that also you have to decide. Why they have to come and meet you repeatedly? Because if it is a malignant tumor, it may, number one, it can recur or it can form a metastasis. To pick up these recurrences or the metastasis elsewhere early, that is the purpose why we are asking these patients to come and meet us very, very frequently. This is what you have to do. And you should know how often they have to come and what investigations you are supposed to do during those encounters. We can also gain knowledge, the surgical knowledge, by seeing and examining a lot of surgical patients. This method of learning is problem oriented and it is multi-system based. It is not a single system. It is problem oriented, not disease oriented. And this is what is called experiential learning, because whoever is gaining the knowledge, he is undergoing this experience personally. Oh, they will never forget because they are seeing and interacting with the live patients. And that is why you see online teaching is not suitable for the medical education. They must see a live patient, interact with them, and they must gain the knowledge by examining the patient, and nothing can replace it. Nowadays, they are using simulated patient, but only with limited benefit. It cannot replace simulated patients, never can replace a live patient because they are not having enough live patients available for them to teach, especially the Western world. Now they are using stimulated patients, but stimulated patient is not a alternative for a live patient. That is the most effective way of teaching the medical students. Yeah, this is clinical surgery and it is problem oriented. The first thing is you are encountering with a live patient, or sometimes this is case based teaching also we can do, especially during the COVID period. We were not allowed to go to the hospital. So in those periods, we used to teach the students with the case based scenarios or case vignettes. We used to share with the students and we used to discuss those case scenarios. This is the best way of gaining the knowledge because it is experiential learning. The first thing you have to, think of whenever you are testing a patient is the differential diagnosis. What is the cause, various causes for this problem? For example, if it is an acute right lower quadrant pain, you should think of patient is coming with this problem. You have to think what are the different causes for this acute right lower quadrant pain. You have to think of what are the causes in female patient, what are the causes in male patients, and what are the causes in pediatric patients. You have to think of mentally, and then you have to do a thorough history and physicals. This is nothing but you have to ask a thorough history, that is symptom, and then you have to examine the patient thoroughly, that is the physical examination, and that is the various signs. So after that, you should mentally, you must have some theoretical knowledge. This is what is called illness script. the various diseases, the various causes, no, the differential diagnosis. What are the clinical features of these various causes for this problem? You have to think mentally, and then you have to compare and contrast the various clinical features of the various, the various causes for this problem. Then you have to recognize the disease pattern recognition is called. What is the pattern of particular disease, or what is the hallmark symptom or sign of a particular disease that will help to identify this disease from to differentiate this disease from the other disease which is also presenting similar to this problem. And this is what is called clinical reasoning, and this is the single most skill you should acquire during your clinical posting. This is what the most important thing, skill you have to acquire, the clinical reasoning, or how to differentiate one illness from the other illness which is also having or which is also presenting with the same problem. This is the most important thing. Then after doing all these things, you have to arrive at a provisional diagnosis or the working diagnosis. So after that, you have to do investigations or workup. And I told you already, this could be a laboratory investigation or imaging investigation, either to confirm your diagnosis, your provisional diagnosis, or to refute all other differential diagnosis. Then whenever you are encountering a tumor, the final diagnosis you have to confirm only by doing a tissue biopsy or this is what is called tissue diagnosis. Without doing a biopsy, you should not come to final diagnosis if it is a tumor. So coming to the treatment, either we can do a conservative treatment or you have to go for surgery. If it is operative treatment, as a surgeon, you should know what are the various steps of this procedure. Step by step, you should know how to do the various surgeries. And then post-op complication and its management also, you must know the early and both the early and late complication. And even after discharging the patient, after managing during the post-op period and discharging the patient, you should know how to do the follow-up for these patients, especially if it is a malignant case. You should know how often they have to come and meet you and what investigations you have to do during these, encounters in order to pick up the recurrence or the distant metastasis early. You should know this knowledge also. And another important way of gaining knowledge, especially how to do the various surgeries, you can read an atlas of surgery, but this will give you only the theoretical knowledge. You should do hands-on. You have to assist to begin with a senior surgeon. You have to go and assist with him lot of cases, gain confidence, and then only you have to start doing it individually. So if you start reading the atlas, you have to keep it in mind. Okay, what is the name of the surgery? For example, if it is appendectomy, whatever may be the surgery, you ask these various questions and just look for the answer in the atlas. Majority of these atlases will be giving lot of pictures. You have to see for each step of the procedure, they used to give a picture. So you can go that, and apart from reading the atlas, nowadays plenty of excellent operative videos are available in YouTube. You can go and watch those videos also to gain knowledge of how to do a surgery. But nothing can replace going and assisting a senior surgeon yourself. Hands-on experience is very important before going to start doing the surgery yourself. Then you have to know about what do you mean by informed consent. You have to tell the patient why you are doing the surgery, what surgery you are doing, and even you have to tell them the various complications that might have happened to these in this surgery, and you have to get their informed consent. A written consent you have to take from the patient. If the patients are very small, for example, pediatric patient, you have to get the consent from the parents. And you have to, next thing is patient's position. What is the position of the patient during surgery? The surgeon should know. And then what anesthesia to be given? Is it a general anesthesia, spinal or epidural, or just a local anesthesia? So all these things you must know as a surgeon. And then what incision you have to make to assess the disease organ, that also you have to know. It could be the various incision, you may be opening the abdomen, or it could be a laparoscopic, assess. That also you have to know how to do it. And then you must know the step-by-step operative procedure. What you have to do after doing the incision, after accessing the disease organ, what you have to do next, how to identify the organ, what are the different steps of the operative procedure. All these things you can read in a good atlas. You can gain this knowledge by reading a very good atlas. And after surgery, you should know how to care the patient during the post-operative period. And if some of them are going to develop some complications, you should know how to deal with that. That skill also you have to develop. And then what are the pearls and pitfalls of doing this particular, operative surgery? That also you can gain this knowledge also by reading a very good atlas. So what are the advantages of using this mind map? So far I have used 3 mind maps, and I have told you how you can gain knowledge by reading a textbook, by examining a patient, or gaining the operative surgery knowledge by reading an atlas of surgery. So now I am talking about the overall advantages of using a mind map. It helps you to remember and recall information. This is very helpful in quick revision of vast quantity of information. Suppose tomorrow is your university exam. Today, if you want to revise the whole general surgery or any surgical subspecialty, you can just go through the mind maps. Within few hours, you can revise vast quantity of information. It helps you to learn new concepts. It is definitely a fun way of learning. It makes complex ideas easier to understand. It improves your presentation. It boosts your creativity and improves your productivity also. It is also flexible. You can make your own mind map by using some software like Xmind. That is what I am using and making my own mind map, and I am not taking it from anybody else. I am making all these mind maps, and I am going to come out with a mind map books. So far in the only one mind maps in surgery book is available. So I am planning to release a book on the mind maps in surgery very soon. So thank you very much for watching this video. If you think that these videos are very helpful, kindly subscribe to this knowledge and share these videos in your social media. Kindly click the bell button also to get notified regarding my latest upload. Thank you once again for watching this video. Let us meet in yet another episode. Until then, bye bye.